Good morning, and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning, and welcome to the Monday Morning Minute. Happy New Year to everyone out there watching today. We're so happy to have you. I have my good buddy Lenny Bisi with me today, and Happy New Year, Lenny.
Happy New Year, Fitz, and Happy New Year's to all of our doctors. It's 2024.
It's 2024.
What a big year it's going to be.
You know, I think 2023 will go down as one of Shatkin F.I.R.S.T's best year ever. And I wanted to thank everyone out there for being a part of our Shatkin F.I.R.S.T company. We celebrated our 20th anniversary this year, and so we've been at it for over 20 years. And it's just been a great ride thus far, and we so look forward to working with you all in 2024. This morning, Lenny, what do you want to talk about?
So what we're going to talk about today, and it's one of the biggest questions that I get from our doctors, right? They get a little bit confused when we're talking about MDLs, Milos, and the mono implants. So we want to spend some time here today with you all just diving into the different kinds of implants we sell here, which are really only two types, right? We have the oval and square, which are the MDL and the Milos, and the mono implant, which has the fixed abutment head. It's a one-piece implant, just those two. So it's oval and squares and monos.
Correct. That's right. And the important thing is that you have a good understanding of how we use the oval abutment and how we use the tapered straight abutment. So Lenny's going to talk a little bit about the MDL implant.
Yep.
The ovals that we sell in 2.0, 2.5, 3.0, and 3.75.
Correct. So the MDLs, so it's the mini drive lock, that one comes in a 2.0 and a 2.5 millimeter diameter, okay? And they come in 10, 11.5, 13, 15, and 18 millimeters, okay? So when you're placing orders for these implants, you can call in and you say you want a 2.0 or a 2.5, and those are the different sizes, 10, 11 and a half, 13, 15, and 18, okay? You're mainly gonna be using the oval and square implants for one, denture stabilization, because that oval and square, that allows that housing in the O-ring to snap on and off. So denture stabilization is one.
Correct.
All right, fix on 6 is the second one. So the fix on 6, that's the restoration with the housings and the O-rings that get cemented inside the porcelain fused to zirconia roundhouse, or the Allure, all right, the Xantex bridge, right?
That's right, our newest restoration.
The housings in the O-rings, those will snap onto these oval and square implants, okay? And you know, for some of you, this may be a little repetitive, but for a lot of our newer doctors, right, we want to make sure that you guys understand this so that when you're planning these cases, you know exactly which implant to use and where.
And I know you brought this model over. And this happens to be a Xantex arch here.
Yep.
And that.
So on here, this one, what we're doing is we have 12 implants here, 12 oval and square implants. These are MDLs. And we have the Allure restoration here, which is the Xantex bridge with the Amberino teeth, okay? So Dr. Shatkin, he would cement this one onto the 12 implants, which were oval and squares, okay? So one of the other restorations that I just talked about, you can use the oval and square implants, the MDLs and the Milos, for denture stabilization, okay? So we do have that model here as well. So what you're gonna do is you're gonna use the same oval and square implants to stabilize their lower or upper denture.
Correct. And you use 6 for the upper. If you get 6 in there, you can cut out the palate, right?
Yep.
And for the lower, we try to get 4. So
That's
we put
correct.
4 in the anterior mandible.
Yep. Now Dr. Shatkin, he'll also cement crown and bridge work to these oval and square implants as well.
Yes, he will.
Okay, but a few years back, you know, we had some doctors, they didn't feel comfortable cementing. We've been doing it for 20-something years now, 22, 23 years, Dr. Shatkin's been cementing to the oval and square implants. But then we came up and released the mono implant.
Yeah, it's an interesting story about the mono. What happened was Dr. Shatkin, he used the mono implant well over a year before he ever talked to any of our dentists about this new implant that he was very excited about. And I remember when Dr. Shatkin was mentioning that we could take this implant and after placement we can bend the abutment back into alignment, there had to be 50 hands in the class that were raised. So Dr. Shatkin assured many, many dentists that this is a wonderful implant, this is a great option in getting things into alignment as far as like fixed cases and single tooth replacement.
Fitz,
so what have you.
Well, the mono implant, can you use it for denture stabilization or for fix on 6 restorations? Because I get that question a lot.
You get that question a lot. So for denture stabilization, we've been stabilizing overdentures with mini dental implants since the year 2000. So it's been 24 years later, right? You cannot use the mono, and I have a model with me right now. We have the straight abutment on the mono implants. So it would be impossible to take an O-ring housing and snap it on that abutment. So what we do with this implant is we cement single teeth to it. We could do bridge work, and we can also do full zirconia, Xantex, or Allure restorations on the mono implant. We try to get at least 8 mono implants into the arch, and it works out absolutely phenomenal. We have a lot of our doctors. Tom Baggett's using it a lot. He's our MDICA out in Missouri. Like I said, Ronald Petrowski is a huge mono advocate, as is Dr. Bob Harvey down in Florida.
He's big.
So he's one of our mini implant centers.
Laskari, she's a big one
down
too.
in
She
Louisiana.
loves the mono implants, the bendables.
Absolutely.
She bends almost all of them.
Yeah, she loves them. But what's unique is Dr. Shatkin brought this implant to everyone's attention. And it's been a great, great implant for thousands of our doctors through the country. And we're so excited to share that information. And we learn more and more every day about what we can offer our dentists. And that's one of the benefits of coming out to a course here at Shatkin F.I.R.S.T. So we're excited about the mono. We're very excited about the MDL and the Milo. The Interlock mini implant is by far the best mini implant made in the world. It's the only one with the ASEAN surface to it, the calcium phosphate. And Dr. Giorno was smart enough to have it impregnated into the titanium. So it's a wonderful implant.
100%.
I can't say enough about it.
And Fitz, one of the things that I want to talk to you about too, so we're a mini dental implant company,
Correct.
right?
We are.
We have implants that go from a 2.0 all the way to a 5.0 millimeter.
That is correct.
Right, so we have the MDLs and the Milos that are 2.0,
Yes.
2.5, and then the Milos are the 3.0 and the 3.75. All right, and then we have the mono implants. They start off at a 3.0 and they go all the way to a 5.0. Is that correct?
That is correct. 3.0, 3.3, 3.7, 4.2, and 5.0. So yeah, we have 5 different sizes.
5 different sizes.
Yeah, and the only one that's non-bendable in that size order that we went with is the 3.0. So the 3.0, it is the only one that you will only see in the light purple box, okay? But the 3.3, the 3.7, the 4.2, and the 5.0, you can get it either bendable or non-bendable. And how you know it from Shatkin F.I.R.S.T, it's either a dark purple box for bendable or a light purple box for non-bendable. But it's a great implant. Like I said, we have tons of our doctors using it, Lenny. And you know, we get
every single day.
calls.
So it's not just our current customers, right? The customers that we're working with, that we've been working with for the last 20 years, that are switching over and they're loving the mono, right? They're not completely switching over from the MDLs and the Milos. The monos has specific use cases, right? So
Absolutely.
when they find one of those use cases, that's when they're using the mono. But one of the things that I'm loving to see is that a lot of doctors who are placing conventional implants, right, that have never placed a mini implant before in their lives, are switching over. They're coming to Shatkin F.I.R.S.T. They're learning how to place these mono implants, and they're absolutely loving them.
Absolutely.
They're finding that the technique to place the mono is a lot easier and simpler. It's more minimally invasive than conventional implants, and they're still able to get a larger diameter implant in there, which is what they're used to seeing and what they're used to dealing with in their offices right now.
Absolutely, and they love the fact that they don't have to carry parts. Like they don't have abutments that they have to order. They don't have to order the screw, the abutment, the healing cap. It's not a bunch of materials that you have to order. It's a one-piece implant. And Dr. Christensen just got done telling us that much less peri-implantitis on the one-piece implant. So keep that in mind as well. But yeah, it's great seeing some of the conventional people come over to
Yeah, because that's how they're dipping their toes in.
Yeah,
you know? But
yeah, absolutely.
We have some doctors that are coming in and they're learning how to place mini dental implants for the first time. They're doing denture stabilization, single teeth. But then we have these doctors who are already placing implants that want to come in and they're trying out the mono for the first time. And they're ordering a lot of them.
They are.
And they're placing them, and you know, we're seeing a lot of growth with the mono implant here at Shatkin F.I.R.S.T. So we want to make sure that everyone knows the difference between the O-ball and squares, those MDL and Milo implants, and the mono implants, right? And the different use cases. So make sure that you tune in next week on the Monday Morning Minute, because we're going to dive a little bit deeper into the different use cases, when to use the mono, when to really use the O-ball and square, and you know, kind of digging a little bit deeper into the case planning that Dr. Shatkin does as well.
Yeah, that'll be great. And of course, you can come to any of our courses. If you go to shatkinfirst.com, You can see our upcoming course schedule for 2024. And this year, we feel it's going to be our greatest year ever at Shatkin F.I.R.S.T. We're so proud of what we've been doing for the last 20 years.
I'm so excited, Fitz. I'm so optimistic for 2024. And, you know, every single day we have these newer doctors, these doctors that have been working with us. They put their business plans together for 2024. And just talking to them and hearing what they have to say, it fires me up.
It does,
all right?
doesn't it?
Because I'm
Yeah.
excited because, you know, the more doctors that I can help grow their practices, I know they're helping a tremendous amount of patients with these mini dental implants and mono implants. So I'm excited for 2024.
Yeah, as are we.
It's going to be big, and
we're excited to be working with you guys for sure. So we hope you have a great week placing mini implants. As always, call us with any question, any concern, give us a call. We'll be back to you in a split second. Have a great day today, and we hope everyone out there has a happy New Year's Day.